So I'll start chatting as people start sitting down. Welcome to the Brain House. For those of you who've been here yesterday, you'll have heard a little of this, so I'll be somewhat abbreviated today. But the Brain House is a concept that we ought to be coming together around the brain. The brain is central to our social and economic health in the 21st century. The WEF has called this collaboration in the intelligent age. Intelligence comes from the brain, right? So this is the idea that brain health and brain resilience are central to our health and our longevity and to our economy as a globe over the coming decades and centuries. So the Brain House is a collaborative tool and a mechanism to convene. You'll see a wide variety of partners here, from industry, Roche and AC Immune, to a lot of advisory services, Milken, and who else? Well, it's interesting. It's only Milken up there, but we have a strong partnership with McKinsey, KPMG, and others. Kennedy Forum is a U.S.-based mental health advocacy organization. West is perhaps one of the largest philanthropic family philanthropic fund for older populations. Rice is, as you can see, and health. Texas is well represented here. This is a wide variety of players across the field. And what are we trying to do with this? First, we're trying to prevent the epidemic of brain disorders in the world. COVID was caused by an infection, and we're now talking about an epidemic caused by brain disorders. And so the challenge is, how do we accelerate the efforts to treat brain disorders? The second major thrust is recognize that it's not just decline of the brain that's important to stop. It's building the capacity of the brain through resilience and through other opportunities that we have to actually do research and then implement skills-based efforts inside the workforce. With demography changing and more people older and fewer people of the working age to support larger populations, if we don't increase the productivity of the labor force, we are going to be in deep material decline in the 21st century. So it is, in fact, important that we move from a brain negative economy, one where we have massive numbers of people with brain disorders and a lack of productivity, into a brain positive economy where we have fewer brain disorders and more productivity. It all depends on how we deal with the brain. And so innovation in this space, investment in the space is critical. Just a couple of things. One of the great challenges on how to deal with something this big, like climate change, how do you create the systems that move us from a carbon-based world into a non-carbonized world? It requires enormous collaboration across wide sectors that are use carbon that have to get off carbon. We're now on COP30. So we've got 30 years of collaboration around trying to bring about that systems change. We're now just starting with the brain transition that's comparable in scope and scale. And so what we need to do is, during the course of 2025, as you'll hear if you come tomorrow morning, what is the path to begin to think through how many systems have to change in order to reduce brain disorders and increase brain resilience? It's education systems, it's research systems, it's a wide variety of systems. And then how do you actually have a set of indicators to see whether the change you're trying to bring about is actually occurring? And then you need a hub, a convener to bring all of those systems managers, so to speak, together and measure yourself in terms of change. And so that's what DAC is trying to do with the Brain House. Well, 2025 will be taking the Brain House on the road, this collaborative mechanism on the road in a number of different places. We've just talked about the World Health Assembly, but we'll also be in Houston with the Business Collaborative, with a large number of very large enterprises who are doing things in the workplace that are increasing the productivity of their workforce, reducing departures and turnover, increasing retention through a variety of skills-based developments inside companies. So companies, individual companies are confronting this. They see the problem. And so individual companies are doing this. How do we spread that effort? So we will also be at UNGA in the fall. We'll be probably at the G7 in Canada in mid-year. And we're going to top off the year in the G20 in South Africa. And what we're going to be bringing to the G20 in South Africa is what you're going to hear about this morning. Because one of the challenge across the board is changing from brain negative to brain positive economies. Africa is rather critical to the future of all of us. Africa is got 40% of some of the population of the world will be in Africa by 2050. Africa has increasing numbers of people who are aging with brain disorders. It has a wide variety of brain disorders, that probably epilepsy being one of them, which is more prevalent in Africa than other places. How do we deal with the brain disorders in Africa? And then how do we increase the productivity of African workers? Because African workers are going to be important for the health and economic health of Africa. But African workers are going to be all over the globe in terms of workforce. So Africa and the Global South has got to be in all these conversations. The largest set of populations of the world with dementia are in the Global South. The largest proportion of the population in a wide variety of brain disorders is in the Global South. So how do we link the Global South and the Global North? Global South can provide innovations because they have to work at lower cost and greater accessibility because of the less complicated set of health systems. In the North, we are stumbling because our health systems are so complicated and so difficult to exercise. So we can learn from the Global South as well as develop tools which are in the Global North, which the Global South can use. So it gives me great pleasure to introduce Alexandre Cabaret from Devex, who is going to take on the role of the moderator of this really interesting panel. It'll be one of the few that you're going to see at Davos this year, which actually talks about the Global South. You don't see anything really in the whole Congress program that really talks about the Global South. This is one that's focused entirely on the Global South, and particularly our work in Africa. So, Alexandre, thank you for doing this.
George, thank you so much. And thank you so much for setting the scene for us today. So what I'll do to get us started is give some introductions about how the event will be structured. So we'll have a number of panelists who will intervene today. We have Miranda Wolpert, who's Director of Mental Health at Wellcome Trust, one of the biggest philanthropic donors in scientific research and R&D. Merali, Dr. Merali, who's an expert in mental health as well, and leading the Brain and Mind Institute at Gaghan University. Catarina, you're with WHO Foundation. And Dieleman, who will get us started, setting the scene with a presentation with interesting statistics about the links between brain health and economic development across the world, and with a focus on Africa, but also Southeast Asia and South Asia and other regions. I think I spent quite a bit of time preparing for this session. I'm not a brain health expert at all. So Devex is a news organization, a media platform focusing on global development topics. We have about 1 million readers around the world, working with international organizations, NGOs, foundations, private sector, and government agencies. We write a lot about global health. We must be one of the publications that write the most about global health, and yet we've almost never written about brain health. So we write a lot about, actually we do, but we did not coin that term. So when I was doing my research on this, I found it interesting that the only article we have on brain health on Devex was an op-ed that was published by George. And and I found that yesterday. Yet, we write every day about non-communicable disease, mental health, stroke, depression, and other topics that are brain health. So as I was reading about it, trying to make this topic understandable for all of us, I thought, okay, so brain health is basically anything that encompasses the physical health of the brain and the mental, right? And I guess the professors here know much more than me about this because they spend their whole life working on this and studying this. So we look at what's the current situation, what you guys are doing to improve it, and what we can do next after this meeting and in the following year. I think one other interesting thing I learned while preparing for this panel is that the Davos Alzheimer's Collective has been coined by Klaus Schwab as a similar initiative as Gavi, the Vaccine Alliance, and CEPI, who both have tremendous impact on global health, human population, and economic development by improving the health of millions and millions of humans around the world. So hopefully we're at the start of something big that George has been shepherding so far, and together with board members at the DAC. And yeah, so hopefully we'll have time to all speak after the session, introduce your questions to the panelists, and we'll get started with you, Joe. We'll have a presentation with some health economics that you've prepared for us tonight, man. Still daytime. Tonight you'll see the stars align.
Can we bring the slides up? Oh, there we go. Great. It's a real honor and privilege to be here. My name is Joe Dieleman. I work at the Institute for Health Metrics and Evaluation. It's a research institute at the University of Washington in the US. I'm a health economist by training, and today I'm going to be talking about the economic burden of brain health disorders. Today, when I talk about brain health disorders, I'm going to kind of lump together 28 health conditions that we, in our research, consider brain health disorders. And so that includes all major neurological disorders, all major mental health conditions, as well as stroke and brain cancer. And so anytime I reference brain health, that's what I'm kind of collectively defining as brain health conditions today. So I'm going to be talking about the economic burden, but I thought, to really understand the economic burden, you first want to understand the health burden. So I'll have a few context-setting slides to tell us about the health burden of these 28 health conditions. So here's a simple bar chart that on the y-axis is disability-adjusted life years. So DALYs is short for disability-adjusted life years. Disability-adjusted life years are a way of measuring mortality and morbidity together. It's a single metric that says, well, let's combine ill health and premature mortality. And so the idea is you don't want DALYs. You don't want disability-adjusted life years. The more you have, the sicker your population is. And this is just counts. This isn't a rate, it's a count. And so it tells us where are people in this world sick with brain health disorders. And I think, the point for me of this slide is I think too often the conversation about brain health disorders is one that is focused on high-income countries, places that are spending a ton of money currently on brain health disorders. And I think it's important to recognize that for every one disability-adjusted life year in a high-income countries, there's 4 disability-adjusted life years throughout the rest of the world. So while the conversation may too often revolve around high-income countries, reality is this is, of course, a very global problem and is an opportunity, I think, as well, that from a global perspective, we can approach much more collectively to learn from each other, but also a huge amount of opportunity when you think about the amount of disability that we could mitigate. So the other slide here on context just tells you which ages disability-adjusted life years are impacting the population. And so there's 2 figures here. On the left is all mental health disorders combined, and on the right is all neurological disorders. And on the x-axis here is age, and on the y-axis is the rate of disability-adjusted life years. So this just tells you, essentially, per 100,000 people, where are these disability-adjusted life years? And the point of this slide is to say, look, mental health conditions on the left are really impacting people in the very middle of life. And I think that's relevant when we think about what are the interventions that are going to impact or mitigate that burden. And neurological conditions or neurological disorders are really impacting most acutely people at the end of life, the later age groups, really from 70 and 80 upwards. So when we think about brain health disorders, for me it's easier to think about mental health disorders, which really are the middle of life impacting really throughout the life course, and neurological disorders, which of course I think the preparation and prevention requires a life course approach, but the disability is often observed much later in life. The reason I show this slide is because I want to highlight the transition that is taking place, particularly in sub-Saharan Africa. So you can see on the top of this slide that there's currently 1.3 billion people living in sub-Saharan Africa. And on the bottom you see what is an age pyramid. So it just tells you that the largest age group, the largest population of people living in sub-Saharan Africa right now is the lowest, smallest age group. It's 0-year-olds, 0 to 4-year-olds. And as you go up, the population gets smaller. So this suggests that, and you can see the little triangles there, show the average age in sub-Saharan Africa right now is about 20 to 25, depending on which sex you're looking at. So it's a very young population in 2025. If we fast forward 75 years, the population goes from 1.3 billion people to 3.1 billion. This makes sub-Saharan Africa larger in 2100 than all of Asia combined. And it's important to recognize that the age pyramid now looks totally different. It is not a young population in 2100, and it is a population that has an average age of closer to 40 and 45, depending on the sex that you're looking at. So again, when we're thinking about mental health conditions, which are, of course, as I showed in the previous slide, really impacting people in the middle of life, and neurological disorders, which are really impacting the older population, I think this is suggesting that while it's already an important topic in sub-Saharan Africa and globally, it will only become a more important topic in sub-Saharan Africa and the global south in general. So changing gears, I'm going to now talk about the economic burden. So what I was describing before is the health burden, how sick people are with brain health disorders. But economists like to try to measure the economic burden. How does this impact the economy? The fact that people are sick with these diseases leads to healthcare expenditure. We call that direct spending. So there's spending on these 28 health conditions. And then there's indirect costs. And this is really, where the spending and the expenditure and the economic burden starts to really blow up. We're talking about lost productivity due to these diseases. We're talking about lost productivity due to people taking care of people who have these diseases. We're talking about lost tax revenue for governments. We're talking about just simple things like transportation costs, all the things that are expensive when you have a disease but aren't factored into just the regular direct medical spending. And so I'm going to focus on two of these topics today. The first is the direct medical spending, so how much money is spent on brain health disorders across the globe, across 204 countries that we study, and also what is the impact of people living with brain health disorders leaving the workforce. And so this is especially acute for mental health conditions where people are, suffering from the burden at the kind of middle age of life and oftentimes having to leave the workforce. What this doesn't include, and I won't include in any of my estimates today, is the cost of caregivers leaving the workforce. And that's why, in some ways, what I'll be presenting today is somewhat the tip of the iceberg. So starting with direct spending estimates, we estimate that globally, across 204 countries, there's $1.8 trillion of healthcare spending on brain health disorders. That's 20% of all healthcare spending in the world. So one of every $5 spent on healthcare is estimated to be on brain health disorders, the 28 brain health disorders that I'm talking about. A lot of that is neurological disorders. A lot of that is in high-income countries. A lot of that is focused on two main groups, stroke and dementia, are the two biggest of the health conditions that we look at. And really, this is direct health spending, money that could be used for investment elsewhere, but is used in order to care for people with brain health disorders. So we can measure this as a percentage of the healthcare spending in each country. And you can see in high-income countries in particular, where there's dark green, the spending on brain health disorders is 20% and above of all of the healthcare spending. This is not the case in sub-Saharan Africa and much of the global south, where the healthcare spending is much less on brain health disorders relative to the total spending on health. But of course, reflecting on those slides that I started with, the expectation is this is going to change over time, especially as the burden increases in sub-Saharan Africa. So the next thing we study is the indirect costs. And this here is, again, the cost of people leaving the workforce because they are living with a brain health disorder. Our estimate here is that this is $1.7 trillion of essentially lost income each year because people are leaving the workforce because of their brain injury, or brain disorders, excuse me, brain injury included. And so 1.7 trillion, just to put that in perspective, is 2% of the global economy. So this is, a non-trivial amount of money that people are essentially foregoing, lost opportunity, lost productivity, because they're living with brain health disorder. And again, it does not include the cost of caregivers leaving the workforce, which for neurological disorders especially is a very large part of the cost of brain health disorders. And the last slide, which I think got cut, but I'll quick describe, is looks at the fraction of the economy that is. And so real quick, the idea here is I said globally, this 1.7 trillion is 2% of the global economy. But if you look at individual countries, this is where sub-Saharan Africa in particular is being hit hard. It is 3.5 to 4% of the national economies of sub-Saharan Africa. So it's having a bigger footprint on the local economy, in particular in lower income countries. And again, in higher income countries, that's a little bit less, but in the global south, it's particularly an acute loss relative to their national income. So with that, I will turn it over to the panel.
Thank you. Thank you, Joe. That's very insightful. So over $3 billion being spent or lost, right, in total in this space. And there is a huge opportunity to improve the current situation. So maybe before we get to Zul's presentation, where you talk about some of the projects that you're running to address this issue, we can bring Miranda in. Catarina, very briefly, on what do you think are the current structural barriers to improve the situation or the systems in the global south, in Africa specifically, but also in other regions where WHO is active?
Thank you. Sorry. Can you hear me? Can you hear me? Okay, great. So thank you very much, and thanks for a great presentation, Joe. So I think there are three structural barriers that I would stress that are directly linked to what was presented. I think the first one being the lack of public funding for neurological disorders and mental health conditions in low and middle income countries, so not only in Africa, but also across the globe. In 2017, only 12% of the countries reported to WHO having a specific budget line for neurological care. And none of them were in the African region, right? So not having public funding is affecting the infrastructure, but also the availability of workforce to be able to respond to those conditions. Which brings me to the second point, which is on the workforce front, right? There is a lack of workforce trained to support with mental health and brain health conditions. This is on the specialist spectrum. So, there is a huge gap in relation to neurologists, psychologists, psychiatrists in low and middle income countries. It's a 70-fold difference between high income countries and low income countries when it comes to neurologists, for instance, per 100,000 population, but also on the non-specialist settings. We see that it's the main entry point for population for getting support, and the primary healthcare workforce. So like healthcare professionals are not trained to be able to diagnose and provide base care for people with mental and neurological disorders. And finally, I think the third point that it's important to keep in mind is that there is a lack of access to medication and diagnosis where these are available. So just to give an example to illustrate, WHO has an essential medicines list that includes medication for conditions such as epilepsy or Parkinson's disease. And again, in 2017, 3% of countries in the African region reported having consistent availability of these medications for these two diseases. most of the time the challenges go all the way back to lacking registration of some medication in those countries, but also lack of supply and affordability. So I think these are three key structural barriers that are largely also informed by stigma around and lack of understanding around neurological disorders that are preventing not only families from actually seeking care, but also policymakers from actually making policymaking and investment, right? So I think that's why the data is so important to show that, there's a need to invest in those conditions.
Great, so there's a lack of funding driven by lack of understanding by policymakers, right? And there's a need for innovation and in this space, whether it's medical innovations or even partnerships, right? So I think this is what Zul will work on, but on the innovation angle and the lack of access to medicine, and can you maybe tell us a bit more of what's happening there, Miranda, and what you see at the Wellcome Trust in terms of scientific research or just awareness building that we could improve with policymakers? Or
Yes, so great. Exactly as you say, this is a huge problem, but there's also some real opportunities coming, and we're starting to see really exciting things emerging. Not only are new interventions being developed by and for those in low and middle income countries, which range from the friendship banks, which Diction Jabanda has been so fantastic in developing and promoting and has now been taken up in high-income countries, but also things like voice technology recognition for people with psychosis developing in South America and other areas. So we're starting to see adoption of things that are developed for interventions in low and middle-income countries going across globally. In order to create that, though, there needs to be a proper pipeline of scientists based in those countries. And we're starting to see that emerge, but we all need to help support that emergence. So the work that others are doing in those countries is exactly what we want to see. So we're seeing populations of neuroscientists develop, being supported by people like the International Brain Research Organizations. And we're seeing data sharing systems developing using some of the data in those countries and making sure they're not just being extracted to high-income context.
right, yeah, because if we want it to succeed, we have to have a health equity approach and a localized approach, right, when it comes to adapting the solutions, right? So Zul, maybe you can talk about that in your presentation. I know you prepared a few slides as well for us to go through and explain what the Brain and Mind Institute is doing.
Sure.
And thanks.
Thank
Go
you.
ahead.
So Zul Merali, I'm the founding director of the Brain and Mind Institute at the Aga Khan University. And we like to think ourselves as moving from the neuron to the neighborhood, a very integrated lifespan approach. So why focus on Africa, other than the fact that all of you have genetic beginnings in Africa, I must say. But I think that Joseph made very important points about why is it important to kind of focus on Africa. But some of the key points that I wanted to bring out or to amplify what was being said is that the older adult population in Africa is really growing rapidly. And it's going to be housing one of the largest pools of people over 60 years. And that if you look at the flip side, as we saw from the graph earlier, is that the youth, Africa is a young country. So there are many young people there. And what is interesting is that the young people will be accounting for 85% of the global workforce increase over the next few years. So here's a continent of opportunities. Furthermore, it's interesting that African populations also have the highest levels of genetic and phenotypic variations, and it provides very rich source of information for us for drug developments and intervention developments. And yet there is a huge data gap. There is, if you look at the world literature, there's very little information that's really coming out from Africa, and we would like to correct that. So in that context, in partnership with Davos Alzheimer's Collaborative, our university and working with Nature Portfolio hosted a conference this September in Nairobi, and the focus was the future of dementia in Africa, advancing global partnerships. So this was a very insightful meeting that brought world leaders and African leaders together to spend 2 days together to discuss what is going on and what needs to happen in the future. And so some of the points that came out from this initiative is something that's informing the Africa Task Force on Brain Health adopted by Davos Alzheimer's Collaborative. And that is, I won't read all of them, but you can see it's igniting brain health, promoting brain power revolution, unleashing Africa's hidden assets, innovating tech-enabled community-based approaches, systems, fueling Africa's brain health engine. And these deliberations are going to be published in Nature later on in March. So what I would like to focus more is on so what can you do about it? So we framed the problem, but what are some of our approaches? And one of the approach is that we would very much like to set up what I would like to call a Brain Connectome consortium. This is a Pan-African network that we are setting up so that we can not only collect the data, harmonize it, do things in integrated in a systematic way so that we can start to generate big data from the continent of Africa. So it will be a multi-partner, multi-stakeholder initiative led by the Brain and Mind Institute as well as Davos Alzheimer's Collaborative. But the consortium fosters equitable collaborations and partnerships to advance brain health research across Africa. Through multidisciplinary approaches in dementia, epidemiology, stroke, prevention, diagnostics, neuroeconomics, policy development, and so on and so forth, some of the key areas that we heard about already. So initially, we're going to unite some of the established leaders in the country. And so there's going to be the country of Cameroon, Egypt, Kenya, Nigeria, and South Africa. And so the idea being that once we initially form this type of connectome, I like to call it, then we will be able to harmonize the way we do business, how we collect data, how we share data, how do we develop methodologies that are common, and to promote multidisciplinary collaborations to help shrink the data gap that I was outlining earlier, advance research excellence, advocate for brain health policies, build continental and regional capacity, very important, as was already pointed out, both by WHO and Wellcome Trust, and to foster awareness and engagement, and to promote neuroeconomics and advocacy. So Alfred is here with me this morning from Cameroon. From Egypt, it's going to be Mohammed Salama. From Kenya, it's going to be me. From Nigeria, it's going to be Rufus. And from South Africa, it's going to be Graham, who runs the institute in South Africa. So just for the start, what we plan to do is to determine the governance framework or how we plan to work together within this quarter and the next, identify the key platforms of activity that's going to revolve around data, about biomarkers, about econometrics, about policy engineering, how can we learn from each other, and about education and how to build capacity. All those are going to be the core platforms within this network. There are many research networks that are existing in Africa that we would like to bring together through this initiative as well. For example, Africa Dementia Consortium, Fingers Africa, which is really an area that's being led by Brain and Mind Institute, but essentially it is to do prevention promotion, because I think there's a lot of opportunity before the expensive drugs become affordable by Africa, that there is things that we can already do right now, and that is to prevent and to promote early detection and intervention for as much as 40 to 50% of dementias can be prevented. So how do we figure out what are the modifiable risk factors? And so those are the kinds of studies that are being done in Fingers Africa. We're doing Resilience Kenya study, looking at what makes us more resilient than other populations. And there is an initiative with bioinformatics in Cameroon. So we're going to bring all those types of partners together under this connectome that I'm talking about. So its mission is going to be to advance equitable and sustainable brain health solutions in Africa and globally through innovative research, radical collaborations, and advocacy. And the vision is a continent where brain health is a priority. As we have heard over and over again, so far it is not. how do we change the picture? So that's it for me. Thank you very much, and I'll pass it on to the moderator.
Thank you so much. Thank you so much, Zul, and maybe we can bring the panel back to the couch. Feel more comfortable. But I'd like to bring in Alfred. You made it all the way from Cameroon, and you're a very special guest because you are leading the neurological department at the hospital of Yaoundé. And so we'd like to have your take on the current situation or the lack of funding. But maybe you can also get us started on the second theme today. What efficiencies we can design by integrating brain health with other health priorities in your country, and specifically in a context of competing funding priorities in the health space. So yeah, and what's your role in this partnership?
Thank you very much. I'm Alfred from Cameroon, and I'm founder of Brain Research Africa Initiative, as Zul has explained. And just to mention that in July and August, with George and the rest of the people, some of the people in here, we did the Yaoundé Declaration on brain economy, brain health, and brain capital, bringing some of these concepts together that were presented at the UN General Assembly, and we'll be following up on that. Just to give you two examples of the situations in Africa, if we take brain health personnel that you mentioned, we just started to train psychiatrists in Cameroon, and very few countries in Africa are training psychiatrists. 80% of the psychiatrists that we train come up to the north and remain. And the reason they remain is that the economic situation in Africa is not favorable enough for them to stay. So these are countries that spend a lot of money to train the specialists that are very few for the conditions that are a big burden and growing, but they migrate economically to the north. Talk about fairness, talk about equity. Now, so you have it. What we decided to do, and Zul mentioned the big data gap. One of the initiatives we created at Brain Research Africa Initiative is to get young Africans with bachelor's degree or higher degree levels and train them in data science, to teach them neuroinformatic programs, R, Python, and all of that, so that they can use that knowledge to source out existing data sets, to ask new questions, to bring out evidence that will be helpful for our continent. And we did this without any funding. We've already trained 40 young Africans from about 15 countries. They're certified, and they are actually now working on their projects. And the condition is that each of their projects should be publishable. We are now in the second cohort, and the number of countries is increasing to more than 20. And we focus on French-speaking African countries because these countries are culturally left behind in both neuroscience production and in producing healthcare that will be acceptable for our people. So these are the situations. So I'm glad to be here because how do we catalyze the economies of African countries to be not only to be brain positive, but to be able to influence the workforce so that African human resources that are trained in Africa or go out and get some expertise can come back and stay in Africa and work in Africa so that we can produce the kind of new things that Zul was talking about that the rest of the world can benefit from. And I think that George mentioned that in the beginning, that we are developing some solutions in Africa that are affordable and that the North can learn from. But for that to happen, we need to keep the workforce in Africa.
Thank you. Yeah, when we prepared for the session, there was this topic of brain drain, right? But then I was personally confused, like brain drain and brain health. How is it related, right? So that's one concrete example of how it's related. So there's a funding problem, there's a structural issue about, on this. And so I wonder, I'd like to explore now partnerships that could help address some of these issues and solutions. So I wonder, specifically on the funding angle, Wellcome Trust, I know you won't be funding health systems, but you can help fund research and create or help create conditions for some of these young scientists to learn and operate and grow systems in Africa. So can you talk a bit more about that?
Sure. So yes, we don't fund direct implementation, but we do fund different things other than just research to help that pipeline go through. And we try and do that really led by the people who know best, such as Alfred and Zoo and others. So one of the things that we are doing is, well, I guess there's three things I wanted to say. One is at the sort of direct translational end. We need policymakers on the continent of Africa who know about mental health and can understand what needs to be commissioned, what needs to be bought, so that they will make sure that there are those policies there that you were talking about lacking. So one of the things we're doing is working with the African CDC to develop a cohort of mental health leaders across the continent of Africa. This is something that has been developed by the CDC. We are simply funding it. We're not involved in the delivery of it. And we're seeing a new generation of policy leaders emerging that we hope will stay on the continent and work with them. We recognise that brain drain will be an issue, even with that leadership course. At the other end, we're funding collaborations of neuroscientists, geneticists, others to look at African data and to come together and form networks. And then in between, we're also looking at how we can form partnerships with the private sector, such as the Africa Venture Philanthropy Alliance, that is looking at ways to bring the private sector investment into the continent. And I think, going back to your question about the brain drain, which we see, it's also about getting researchers to understand the entrepreneurial opportunities on the continent and to think like entrepreneurs, which is an issue also in the global north as well as the global south. But in all areas, we need a workforce, at least part of which is more savvy about ways to get things implemented and more interested in that aspect.
Thank you. At the WHO Foundation, do you have any specific examples of partnerships with the private sector in this space as well, or how it could be scaled up?
Yeah, definitely. So WHO is implementing a special initiative for mental health and brain health and substance use abuse disorders across 9 countries, which include 2 countries in Africa, so Zimbabwe and Ghana are part of it. It's been ongoing for 4 years, and it's an initiative, it's a program that works on the one hand with, similar to what Miranda was saying, it works with the policymakers to promote reforms, to include for instance, in Ghana, mental health conditions into the benefit package for the primary health care, but also on the other hand works with training the workforce at primary health care level to be able to diagnose and provide care for these conditions. And this initiative is an initiative that receives a lot of funding from the public sector, but at the WHO Foundation we've been mobilizing also corporate partners and philanthropic donors to invest in this initiative. One of the donors that we have a big retail brand from the L'Oreal Group, for instance, that is investing in this program because they see it as a very good return on investment for each $1 that they invest in the special initiative in these countries. They are supporting the increasing access to treatment to at least 2 people. So they see it as an investment opportunity, more than just also the human imperative, right, of contributing to that, since it's a priority for them, not only from the business perspective, but also from the workforce perspective, you know, and the community perspective. So we have some of these examples where there are clear programs that deliver on the ground, so not only working with policymakers, and we are crafting partnerships. That's the role of the WHO Foundation. And I think it's never been more timely because a lot of this work in mental health and brain health is poorly funded, but also with the recent announcement by the US administration of the intention of the US to withdraw from WHO, there will be huge consequences for low and middle income countries because the US is one of the major donors in the global public health space. So we are really working hard at the foundation to, you know, to communicate and send the message that, you know, we need individuals, we need philanthropists, and we need the corporate sector, just as the examples that were given here today, and these type of collaboratives to advance this topic.
Right, and we also need other donors to step up, but we need smaller solutions, more efficient solutions maybe. But the business case for the private sector is interesting, and they can, indeed, that contributes to community resilience that contributes to the development of the workforce, so it's actually a real business case for them. And the other thing is that maybe we could think about how the private sector could further integrate diagnostics, for instance, or help, brain health within their own workforce. But Zul, you wanted to build upon what Miranda was saying.
Yeah, I think that there is also a huge need for people to develop in the continent itself. How can we mobilize what we have? I mean, it'll be a challenge to get in enough psychiatrists and psychologists, we know that. But then that is actually using the global north approach to mental health and brain health. But I think that there are ways of getting around it, particularly with the WHO, task shifting and bringing in capacity for lower level health workers, giving them electronic devices to be able to enable them to provide services. We've done pilot projects in Asia, and now we're bringing it to Africa, where actually people can go door to door using tablets, figuring out who's in need of mental ill health, how intense, and be able to provide care, just like Dixon Chimamanda did in Zimbabwe with the grandmothers. So similarly, using models to provide care and service. And I think that, so we need to be innovative in how we can do it. And we've seen that the symptoms fall by about 60 to 65%. So it's highly effective. And so we would like to kind of make approaches like that complementary to the professionals, that we will have a hard time filling that gap.
And what about the prevention angle? I mean, we're talking about the, especially in lower income contexts, talking about the first 1,000 days, nutritional impact on brain development, talking about access to education, yes, and the role it has on brain health, yes, and so how this can come into the equation.
So it's a very good point that you bring up, and I think that I mentioned the project that we have started already, funded by MRC UK, and this is Fingers Africa project, and that project essentially looks at 5 or more modifiable risk factors. So first of all, we get to determine what are the core modifiable risk factors in Africa. It includes nutrition, it includes exercise, includes social isolation, things like that can be mitigated. And then what is the impact of implementing those through a clinical trial in Africa to see, can we then avert the onset of dementia and Alzheimer's disease? And I think that's exactly the way we need to go. As I was saying, prevention promotion is extremely important until such time as we have new and powerful drugs that are affordable that come to our way. It's going to be quite a few years, I'd say decade at least. And so here's something that we can do here and now. Mm-hmm. So that's how we're trying to approach that particular approach to the multidimensional, preventable life course approaches.
Did you, thanks so much. Joe, in your study, did you look into this at all, the prevention angle and or the child development angle of it, or not yet?
Not yet, we have not.
Okay, all right. No follow-up question on this then. but yeah, the prevention is often the best buy. But yeah, go ahead, Miranda.
Yeah, I just want to come in because I think the point you made earlier about we need to do these things until we get the professionals in, I completely get. But I also think we need to be careful that we don't think that this is just about waiting till the professionals come in. I think we all need a revolution in mental health, whether we're in the global north or the global south. And that isn't going to just be more psychiatrists, more psychologists, more social workers. It is going to be a completely different way of thinking about the interaction between prevention and intervention, and about who does it and how it's done. And I guess there is an opportunity here for the continent to be a leader. I mean, I don't want to gloss over that there are huge gaps and we need more professionals, we definitely do. But there's also an opportunity, and I think you're showing that leadership, to take things in a different direction, to find ways of doing things in different ways that can really show the whole world and not make some of the mistakes that have been made in the global north about how things are done and how they should be done. So I suppose I would just want to say that, and just on the issue of drugs in particular, I guess there are things we could possibly learn from other sectors, such as infectious disease, about how we can have arrangements with drug companies to allow for cheaper drugs to arrive on the continent and elsewhere. And I think that's something that requires a concerted effort between public and private again, and there's no reason why we can't do that for brain health. And cheaper doesn't mean worse, it just means they're appropriately priced for a different population. They're same good drugs.
So can you share a specific example maybe of one of your strategic funding that you've done in this space at Wellcome Trust that maybe changed the game for brain health research and innovation? Maybe in the, as you were talking earlier about on digital tools or AI or...
So we have a prize that is just, I think, just coming to an end now, and across the continent of Africa, an African Data Prize that's being run through the African Population Health Research Centre, and they are awarding prizes to researchers to use data already on the continent to advance early intervention for anxiety, depression, and other problems that people have across the continent. And they're developing new digital tools. We ran the same prize in the UK a few years ago, and it led to some really exciting new tools. The winners are just being selected now, so we should be able to announce those soon. And those will be the new entrepreneur inventors bringing together data science and mental health research across the continent.
And they're in the screening space, I guess.
No, not just screening. Could be intervention, can be understanding, could be screening, could be any range. It's a range of digital tools using secondary analysis of existing data.
All right, thank you. Yeah. Please introduce yourself, and do you have a question or?
Yes, I have a question for sure. So I'm Harris. Well, we know most folks here, but I'm from Rice University. I wanted to open up the box of G20, which is in South Africa this year. This is amazing when we sort of thread the needle together and weave this all together. So how do we get on the G20 agenda? We talked yesterday about the G7 is very interested in productivity. How do we connect the brain health to boosting the productivity of individuals and nation states and businesses? Is that a useful thread in the G20 South Africa? And then, would you be open to working with George and I to think more about how to position ourselves in the G20 with heads of state, finance ministers, and/or health ministers? Because it feels like now is the time. But do you agree?
Yes, I absolutely agree. I think that we need to mobilize, and that is one of the reasons why we're creating the network, is to kind of peer pressure across countries within Africa how to move the needle forward. But I think that we need to all to come together, because very often when you look at scientists, they tend to work in their silos. And how do we kind of change the paradigm so that we're not just working on our pet areas of interest, but also looking at the holistic picture. And so it's critically important, and I think now is the time to kind of really make a difference, because we keep on saying it's a no-brainer. I mean, if we want the continent to develop, the globe to develop, mental health, brain health are one of the largest burdens of illness, and it's robbing us of our potential, changing the trajectory of young people to get educated, for example, when they get impacted. And what a benefit would it be for these countries to kind of stem that flow and keep people healthy through those transition years, these young people especially, to make a difference for the countries and for the globe.
Maybe we could have a multilateral sometime this week to talk about this further. We have this concept note being developed for the G7 in Canada. I think we can repurpose that for the G20 South Africa, but we need help. Anyway, let's go together.
Is this looking at, oh, sorry, go ahead, Joe.
Well, I was just going to, an anecdote. I spoke with someone who was kind of on the ground working to get PEPFAR and Global Fund funded 25 years ago at this point. And, when the stories they told me was that they were very strategic in the way that they approached every individual, in this case in the U.S. legislature, who was a potential vote to fund this major bill. And it was kind of an interesting anecdote, because it referenced the real sophistication and the effort that was needed to bring this to global attention, in that case HIV/AIDS. But I think in this case an equally compelling argument can be made. Everyone has a personal connection, of course, to brain health disorders. And so what is needed, I think, is maybe more sophistication in that argument, and ultimately to be able to convince people that there are options, there are opportunities, there are ways that this can be averted. It's not just a diagnosis without options. So.
Sorry. No, go ahead. I completely agree with that, and I think just to share my sort of own personal journey, I think I've come to realize, partly through conversation with Harris and others, that unless we're in the big tent of brain health, we're just going to be fighting each other for more and more limited resources and also confusing other people. So, I've learned from Harris, the three buckets, whether it's neurology, mental health, and then brain skills, all of those together are a compelling argument. And I think we've also got to be, certainly within the mental health community, got to be more savvy about how we talk. So if productivity is the way that someone understands it, let's talk productivity. But that also means bringing colleagues with us who are very passionate about all sorts of other concepts. That's fine, but that passion can stay for the internal group. And externally, you need to think what the policymaker is interested in and what's going to speak to them. And I think that's a sort of a maturity lesson for our group, because we have been underfunded and underrepresented. We're used to talking to ourselves. Now is our chance to be on the global stage. If we're going to talk to other people, we've got to be as one message, and then we can have our internal debate. So I think things like the declaration are fantastic. Things like the other people are doing, these are exactly what we need, these coalescing things to find the biggest tent we can to make the arguments.
I would just like to add one point. I think when it was mentioned working with ministries of health, ministries of finance, I think we should also not forget about the corporate sector, in particular for reaching the ministries of finance. I think it can be very powerful if we're talking about productivity, to really make sure that they also understand. I think there's a lot of momentum with the corporate sector when it comes to mental health in the workplace, for instance, but not necessarily on the brain health, looking from the angle of the workforce that is coming, but also looking from the angle of the productivity of the existing working force. And I think there was a point made earlier both by Miranda and Joe around early childhood and caregiving. I think there's also another angle not to forget, right, that a lot of the workforce productivity issues are also related to the fact that they have this double shift, right? They're working in the workplace, but then they're also taking care of other the young children, babies that are in a very key moment of their development, or their older family members that might be facing dementia or the disease. So I think, also using the right, sending the right message also to these very powerful, corporations that can also help move the needle and send this message across to ministers of finance, I think should not be neglected.
Yeah, maybe just make one last point. I agree with you. I think that Kelly O'Brien's work with the Business Collaborative can weave in here. If we could get some big oil and gas companies, mining companies that work in Africa to take this on board, I think that's point one. Point two, I think we've had Rob Kaplan from Goldman Sachs speaking yesterday, so how do we involve him in this discussion, getting the Goldman Sachs type thinkers here? Jim Kim, the former president of the World Bank, is now at BlackRock. He's very interested in mental health. How could we potentially involve him and, in some discussions? So I agree with you. So
on the theory of the big tent, we have perhaps the person who represents the biggest tent here as a guest, and so I'd like JR to introduce him, if you would.
Sure. So Cardinal Turkson is the Chancellor of the Pontifical Academy for Sciences and the Pontifical Academy for Social Sciences at the Vatican. Is from Ghana. He didn't know we were going to call on him, so hopefully he's okay with this. But Cardinal, could you maybe just comment on what you've heard? And obviously, you've done a lot of work in the church and the global south. Maybe just a brief word?
Thank you for the surprise, and I was just hoping to just sit in the back and just for once also be on the listening side instead of always the talking side, and so you blew my cover. And now I like to congratulate all of you, members of the panel, for the insights and everything that you've shared. Just wanted to draw attention for one small experiment we did years ago, to just mention the role of domestic support for mental cases. There's a lot of stigma, as you pointed out, to all of this. And where they do have good domestic support, they invariably sometimes are able to transition from being victims or being sufferers of this to full integration in society, healed, as it were, of the problem. And that's just one small point that I just wanted to introduce to this. Domestic support in all of this, in all cases of mental estrangement and all, The other small point that comes up is also homelessness and the lives on the streets. A lot of domestic or mental health cases invariably also become homelessness or homeless people on the street, and so recovery also, an extension of support to people who are on the street is also a big factor to consider in all of this. But to congratulate you and thank you for sharing your experience with us, and I'm from Cameroon and all, because my secretary is from Cameroon.
Let me just ask the panel. For many people in the world, a spiritual aspect of the brain is important to resilience and to be able to get through challenging times. I'm curious as to whether or not the spiritual community, the faith community, is a partner in some of these efforts to build the capacity for resilience.
So maybe I can comment on that, George. I think that when we do the analysis of people who seek help, one of the, at least in Africa, one of the first portals for them is the house of worship. And the second one is community health providers. And then third is the medical pathway. So, so yes, people seek support from the spiritual side, very much so. And there are issues there in the sense that many of the spiritual leaders are savvy about mental health issues and are able to guide people for the right level of help. But we've had imams and ministers and pastors talking to us saying, we need help because we don't know what to do when they come for mental ill health to us. So we've developed courses for them. We're calling mental health first response, so that we teach them how to recognize mental ill health and then what to do and what not to do. They feel very relieved because we tell them that it's not your job to actually treat them. Your job is to be supportive and guide them to the right pathway to care. And they very much appreciate that. But yes, that's a major pathway, and spirituality plays a big role, and there's a lot of literature that actually indicates the value for those, for the believers in that as a resiliency factor that cannot be ignored.
Thanks. Yeah, I have.
Can I just make a comment on that?
Of course, yeah, sure, go ahead.
Okay. Morris Friedman, I'm from Toronto, Canada, and also I'm here on behalf of the World Federation of Neurology. The spirituality, if I can just make a comment, we actually did a study on this, looking at spirituality and progression of Alzheimer's disease. And we found that we looked at various measures, religiosity, private practice. We found that the measure of spirituality, which is a feeling of a closeness to Supreme Being, and private religious practices actually slowed the rate of progression of Alzheimer's disease. Going to public places of prayer didn't, but private did. Why that happens, I don't know. I just wanted to say that we actually did research on this. It was published in Neurology back in 2007.
Great. Yeah, I think we can go to questions from the audience. So we had a lady there with her hand up for a while already, but and then we go to you. Maybe we can take two questions at a time.
Yeah, thank you so much. It was exactly on this because I wanted to bring up the topic of the yes. Thank you. So I don't want to echo now what everyone else was saying, but my question, my name is Stephanie Ludwig Roche, was going exactly into that direction. So if you build those networks and all of these joint alliances and initiatives that I find super inspiring, spot on, where is really the actual active role in all of this for them not to be forgotten, the traditional healers across the communities to really provide, with everything you're coming up with, broad access to broader African populations. So I'm very glad that this came up, and thank you.
Thank you. And then we can take another question there. Yeah.
Thank you so much. Again, thank you guys for an excellent presentation. Everything's excellent, the work you're doing. George, thank you for your leadership, you and your team. My name is Bill Preston. I work with the Rosa and Raymond Parks Institute, and many people aren't aware of, and I champion it so valiantly because I love Mrs. Parks. Mrs. Parks had Alzheimer's, so I share that because I wear the button to let people know, you know what, honestly, women are 2/3 of the cases with Alzheimer's, we don't know. But nonetheless, I was blessed to be able to deliver something to the new CEO of the Nelson Mandela Foundation, I'm going to pronounce the name correctly, but nonetheless, you know what I'm talking about. Thank you, George. Thank you for correcting me. We had an interesting discussion. Madiba would be proud of the progress that was made on HIV/AIDS when I met with him on December 11th. The thing is, it's now time in Africa, to me, this is my opinion, my humble discussion with him, it's now time to pivot, and Madiba would want us to do that in Alzheimer's for Mother Africa to have this discussion. So the G20 does present that opportunity. I think he would be willing to champion that, to make sure that there is a seat at the table. This discussion has to be discussed. There's no greater time to have this discussion in Mother Africa right now. I'm praying that other Aspen Pharmaceutical Company will ask me. I had a discussion with an executive leader of that team back in September after leaving Zul's program. We had a wonderful discussion. His feeling was, we're not quite ready. We love the idea of it, but we're comfortable with our biosimilars. Well, you know what? That's not going to be good enough. Africa has to have a seat at the table, and I'm challenging Aspen to move forward with it. And they're going to be very active in this. So between Aspen and also the Nelson Mandela Foundation new CEO, he's very progressive. He sees the bigger picture. So if I can be a conduit, I want to be a part of that, because George, you and your team are doing a great job, and I just, whatever I can do, I mean, if I'm not needed, that's wonderful, but obviously my passion is to be serve in any facilitated role that I can. And again, thank you guys for what you're doing. God bless you, and thank you for this great forum, and let's make it happen. And South Africa, God bless you. Thank you.
Great, go for partnerships. Maybe we can go on these two quickly, very quickly, on traditional healers and then on the policy momentum. But did someone want to have a question on these two topics? Okay, we can take a third question and then we'll let the panelists answer. Yeah.
Okay, great. Hi, everyone. Lily Troutwell from Dalberg Advisors. I really appreciated your comment earlier about the need for a data repository and really understanding a dispersed data set. You know, one of the things that's also what it sounds like as an observer is there's an asset being developed, and as we look at drug discovery and the need for LLMs, et cetera, there could be a potential for a large data asset. And so, yes, it's important to have funding for it, but the work you're doing, and you may have already been thinking along these lines, is generating an asset that becomes incredibly important. And having worked across a number of clinical research areas, the ability to access genetic data and biomarkers and all the things that you're planning to collect becomes so important.
Thank you. Okay, thanks. So can we go back? Maybe we'll just go back to these first three comments and questions. One on traditional healers and the importance of integrating them into the response, or whether it's prevention or response. And on the policy momentum, the G20, there is this NCD high-level meeting happening later this year, where mental health is on the agenda, together with other diseases that are related to brain health. So who wants to respond to that? On first one, maybe on the traditional healers one. Did you want to comment on this?
So yes, I think that to address the first point is that it is so critically important when you're working in Africa to realize that you need to engage the communities fully. You cannot be working in your silos. So what we have done to approach that problem differently is what we have created, something called the Living Lab, which works in the communities, and the communities are the informants and partners with us in terms of whatever we do. They need to be at the table, including religious leaders and community faith healers. They're all part at the table right at the outset, so that when we develop the strategies and approaches, that it is acceptable by the community at large, but they are informants for us in terms of how to move forward. And we need to kind of work in lockstep with all the community providers. And so it's very important that we do. So that's one approach that we're actually testing out right now.
Thank you. I'd like to add to that in terms of sort of the revolution I was talking about earlier. I think requires thinking about this also not as spiritual leaders or others necessarily only being a sort of conduit into more professionals, but actually about being co-designers of what is the intervention that people might need. So I think this is partly a mind shift away from the idea that there's some magic professional out there and actually these things are sort of lesser. I don't think that's true either in the global north or the global south. So co-creating with people with lived experience of mental health problems, what they need and what helps them is a challenge for the whole community. And I think we're seeing a bit of a revolution in that. So the sort of things we're seeing that anyone can do, and that people with the skills to listen, to have compassion, to understand human nature can do, are things that I think are changing, and I think those digital tools that we're seeing come through will be in the hands of all those people, and not just in the hands of professionals that are at the end of a long triage and waiting list.
I wanted just to echo what Dr. Zhu and Miranda said, and just add also that it's very key to, and that's the community-based approach, right, that it's advanced by WHO, by Wellcome Trust, by many other organizations, because it's really key also to partner with these traditional leaders when it comes to actually effectively addressing stigma, right, and raising awareness within the communities, right, because as Miranda rightfully said, it's not because of someone's authority, because it's a member of a medical, community or has a certain degree, at the end of the day, those that can really, understand, listen to the community and send across the right messages are the ones that are respected because of their seniority or because of their religious spirituality, role in the community. So I think it's critical to reach the last mile, but also to ensure scale, are this community-based approach that really takes into consideration and works in a collaborative way with the traditional leaders.
Thank you. I think we had quite a few other questions. Maybe one here to start.
Thank you very much. Mine is just a comment, but I think my comment has been addressed by the gentleman and the lady there, is in terms of sensitization, really. Because in Global South, especially in Africa, until you see someone go naked and run man on the street, that's when you recognize as he's mad. If you call if you call your workplace and you say, oh, you have some issues, the person says, oh, this guy is lazy, So that mental health issues have not really been recognized. And there has to be advocacy in interventions and programs and sensitization to be able to make sure that everybody is on board and fully understand this. Thank you.
Thank you. So we'll have a question on awareness raising and understanding of the issues. Yeah. Do you have a mic nearby? Oh, sorry.
Oh, were you going to ask a question? I'm sorry. No. Go ahead. I'll wait. So I'm seeing this a common thread, and it's beautiful to see this. So my company, Norextem, is funded by the Department of Defense for PTSD. And we've been looking at something that's very fascinating to do with stress. And the question really is, and stress is a factor in Alzheimer's. So what I'm trying to see here is between spirituality and the intersection between racism and stigma and also trauma, which is what the veterans suffer, they all have one common place, which is chronic stress, acute stress, and anything else that the environment in which you are actually is exhilarating, and in our case, particularly exhilarating Alzheimer's and dementia. And so I am looking at what's going on in Africa and the themes that are going on there, and what I'm looking over here, the veterans, and I'm trying to see how I can be part of something bigger rather than just acutely what was funded, what we were funded by the Department of Defense here in the United States.
Great.
So I would love to connect.
Great. So thank you, and I think this is what the organizers want. It's getting more lives, more people to partner on this. Yeah, please go ahead.
Thank you. My name is Margaret. I'm with Crisis Text Line, and I've worked across a number of sectors, particularly in Africa. And so I really appreciate the conversation and suggestions, and I think that there's some amazing historical models that have worked to engage with different change agents that are leaders from within the community through education. If you think of how VSLA started and was mobilizing through women, for example, faith leaders that have also been engaged to support education systems. I think the same kinds of approaches that I'm hearing here, it doesn't have to be one or the other. I think each community, you can look at who's leading and helping, positioned to lead change. And then the other thing I wanted to say is that we have new and emerging evidence about the power of a sort of a dual model in terms of how we're approaching crisis response at scale. And in our case, we train volunteers, so it's anyone, anywhere, who is willing and able but not a trained clinician, to go through a training that gives them the skills to respond effectively to someone in crisis. It's very much, as you were describing, not to treat them, but to be there for them. And so that's a response intervention, but we've also then analyzed the effect of that on the volunteer and on their families and communities. And what we're seeing is that it strengthens the resilience of the person who's responding, but it also increases the resilience of their families and their communities. And in particular, we're seeing last year, for example, we supported through this model 1.4 million crisis conversations in the US alone. And our volunteers, we estimate based on their responses to our survey questions, that they also supported or prevented as many more in their communities during the same period of time.
Thank you.
So they're really, I think, exciting models that I'm
Thank you.
seeing
Yeah, and we can bring
mobilized.
in, extend these interventions to volunteers, caregivers, community health workers in Africa that are very important. Did you have a question as well? Or? Oh, no, okay, you're good. Okay, we can take one last question and then we'll do, we want to keep 15 minutes for networking and connections, but yeah, go ahead.
Thank you. Sorry, so yeah, I'm Nick Hudson from IQVIA. We're a global trials healthcare data analytics company. Miranda, I think you met with Dave yesterday. My question was really about technology, but actually coming at it from the angle of the risk factors with brain health. So I don't think anyone would have missed the AI billboards around the valley this week. And obviously with the skills gap in Africa, that's a great opportunity, but I think more in terms of the population pyramid and these young people coming through that are really going to be, not just digitally native, but kind of AI native populations. You mentioned that we've got the neurodegeneration at the top of the pyramid, maybe mental health in the middle, but particularly for our young people, the next generation, how is technology actually as a kind of risk factor in a lot of these things that we're doing from a policy or a research perspective? And with Africa, I guess the technological adoption gradient is so much higher than we've probably seen in places like the US and Europe. How are we managing that from keeping our people kind of safe, and how are we actually using an evidence base to show what, potentially technology addiction has on things like depression, anxiety, social isolation? So quite a big question, but I just wonder from people's different angles, how is the risk of technology actually being thought about?
Did you want to say? So I think it's a very important point that you bring up, but there are two aspects to technology. One is, of course, this issue of social media, pressure on youth, toxic conversations and things like that. And people not getting enough sleep. We haven't talked about sleep, but that's a critical detrimental factor that's coming through media usage as well. So it's a very important point, and we need to address it. Many countries are starting to address it. Brussels recently, South Africa thinking about it, about taking off some of the TikToks and things like that that might be the conduit. But it's hard to kind of totally dissociate from that, but it's a risk factor that we have to address seriously. But on the flip side of it is that the technology is also going to help us identify people who are at risk. Through conversations, through wearables, picking up your sleep patterns, your gait, your speech patterns, things like that, can be very, very informative about whether you are at risk or not. So we can use it both ways. And it's exciting in Africa, like it's a super fast introduction of technology. I was born in Uganda, and when we wanted a telephone in the home, we had to wait 2 years to get a landline in, okay? I come back now to Africa after spending many years in Canada. The first thing I notice is that everybody has got a mobile phone. You might not have shoes, but you have a mobile phone. Why? Because nobody carries money in their wallet anymore. It's all M-Pesa. It's amazing, like so fast. So from person to person, transfer money, bypassing the banks completely. So the technology, like we can leapfrog rapidly in Africa. So we need to kind of figure out how can we harness this technology also in the same way to be diagnostic, to be identifying people at risk, and finding out ways of can we intervene at the right time, at the right place. Yeah.
Great. Catarina.
Yeah, I would also like to add to that. Similarly, I think there are huge risks with these technologies if there are no ethical considerations. There's risk for potential bias, but there's also an opportunity. And there are, I think, different angles. One that we see is with leveraging these AI-generated chatbots, for instance, for increasing access to adequate, reliable health information when it comes to mental and brain diseases for communities that otherwise probably wouldn't be able to access the information. But also we see a lot of examples, and we've been crafting a lot of partnerships with corporate and philanthropic donors, but also individuals that have an amazing reach on social media and other communication channels to really help break stigma again on these conditions. So being careful of not over-medicalizing some of the conditions with people self-diagnosing, but helping spread the word about the existence of these conditions, what it means, how you should seek help. So I think there's also a huge potential of technology in that front as well. And we've been seeing great examples that WHO is leading with the FIDES network, for instance, which is a healthcare influencers community that is supported together with many other organizations and tech companies to really spread reliable health information around mental and brain health.
Okay, thank you. I think we're at time, so we can do a last round. I want to ask you, what do you want to see happen this year? What action will you take to, if you sit here next year, and we can talk about what we've achieved, maybe through the G20, maybe through this NCD declaration that may come up in September, or other funding commitment. Or, so I'll give you each about 30 seconds, 20 to 30 seconds. We can start with you, Alfred. You want to be part of it? I think you should be part of it. Or you want to finish? You want to be last?
Not last, maybe in the middle.
Okay, so Miranda, we start with you then.
Okay, I think there are two things in my mind that we want to do. One is I want to get in behind others in this bigger tent. So I want to join with others. I don't want to necessarily lead. I want to be part of it. And so just that's an offer. Insofar as we can help and support, we want to be at the table and we want to be on message and being politically astute and disciplined. I suppose that's one thing. And then the second thing is more specific to us. We want to be working with partners on some of these ideas around how can we get equitable access for medications, how can we bring innovation to Africa, how can we get tech that will be both exciting and opportunistic but also not unalive to the issues. So those will be things we'll be doing with partners as we go.
Thank you. I'll also mention two things. One that we didn't talk about as yet, and that is loneliness. I think we're learning more and more about how important feeling of loneliness is to the development of brain ill health and mental ill health in particular. And I think that was partly to do with the technology coming in. We now have virtual friends, but we've forgotten the skills of interacting talking about the youth, with direct friends that you kind of fought with, played with, and were on the streets with. That's not happening as much anymore. And loneliness now has been shown to have a major neurochemical change in your brain, making you more susceptible to brain ill health. So I think that is something that we need to keep in mind, not just for brain ill health, it is also for physical ill health. And so I think that is something that we need to collectively figure out solutions as to how do we really tackle this really major issue. And the second thing is that I think really what I would like to see, and that is why we're talking about creating of the brainectome. It's a takeoff from the connectome, which is the connectivity within the brain. It's the same thing we need to have, scientific connectome that kind of brings all us together. And because that only with togetherness will we be able to find solutions. In Africa, we have a proverb saying that if you want to go fast, you can go alone, but if you want to go far, you go together. So I think that it is really a desire to work together to kind of really change the scene collectively is my hope for this year.
Thank you. I think for us at the WHO Foundation, what would be really critical would be to ensure that there is this multi-sector multi-stakeholder collaboration, similar to what the colleagues were saying earlier. But it's not only in terms of advocacy for equitable access to brain and mental health in low and middle income countries, but also in terms of resource mobilization, so that there is actual resources that are going to be allocated for supporting the scale up and the development of all of those innovative community-based approaches and interventions that can really move the needle in low-income countries, with never forgetting about the health equity angle, right? For us at the WHO Foundation, what is really critical is that, yes, while it is a global issue, we've been talking over and over again and here about the health disparities, and so not forgetting about, what is really equitable and how you can reach the last miles.
Thanks. I think if I think 1 year into advance, what I think about is equitable access to pharmaceuticals and drugs and diagnostics. And I think an ongoing conversation that's maybe a little, that is cogent and delivered at places, where this brain house goes to, and gives a message of both hope that this can be done, but also that it requires resources, that there's a certain element of resource mobilization that's required in order to lead to equitable access for diagnostics and pharmaceuticals. I think that's a message of hope, and it is important, and it's also very grounded in reality that resources are needed.
Thank you. So Alfred, you're not last, because we'll ask George to close. And maybe George, after you can give us your vision for what should happen this year after Alfred, and where you'd like to see DAC in 25 years. Like, we're looking at the analogy of Gavi, that's 25 years old this year. Where you want DAC to be then?
Thank you very much. The first half of what I would like to see in the next year is the brain house taking place in Africa. This would bring the policy makers in Africa, the researchers in Africa to come together. To have this kind of thing in Africa would be a game changer. And the second half of it is that we would like to see the brain university in Africa that would do university training, not as it is traditionally done now, to be able to meet the challenges of the future.
Okay, before I let George close, maybe I'll give mine, and I'll definitely talk to our newsroom, our journalists, to cover these issues in a deeper way in the year to come. And we hear your call, and maybe Stan is in the room. He keeps pitching building this house in other places in the world, so I'm sure I'd be very happy to take it to Africa. George, over to you.
Well, this house actually moves, right? So, I mean, it comes apart and goes, so I'm sure one of the stops it could make. We've already talked to Stan about doing this at this G20 at the end of the year, so I think that will happen. So this year, I think, is a year of mobilizing the collective power, finding the mechanisms to convene, the themes where we want to put emphasis, and then beginning to think about how to measure progress. So over 25 years, 2050, we will see definite change as a result of collaborative action on the part of all the industry sectors, and obviously resource mobilization, political mobilization, more a collaborative effort on the part of the world to emphasize the importance of reducing the epidemic of brain disorders, and quite frankly, figuring out what we have to do to increase worker productivity. That sounds such a distant and emotionally distant phrase, but how do we really permit each individual to recognize their full potential and to do it in a way in which everyone is understood and listened to, and in fact finds a way, or the system allows people to find their way to a healthier and happier life. That's a big statement, but we've just heard what happens in 2050, or what the situation will be in 2050 if we don't do anything. We're going to have an upside-down pyramid. We're going to have a huge burden of brain disorders in Africa and the rest of the world. Asia, important. We met here with the Singaporeans about putting something up in Asia. We're talking to the Colombians about doing something in Latin America. How do we actually mobilize this? So somebody's going to have to we'll take this on to try to convene, but it's going to take a lot of people thinking about how to work together, or at least working in parallel fashion to produce a different result than otherwise would occur in 25 years. And it's a bit of a challenge. So this year is a year of organization, mobilization of that collective spirit and collective will, and then collective strategy on how to move this whole brain health issue forward. Thank you for excellent moderation. Thank you, panel,
Thank you all.
for really interesting